My name is Rian Cadiz, and I am a coronary care nursing student from Seneca College. In this video, you will see health history assessment, the PQRSC assessment, and the auscultation, inspection, and palpation of the precursum. I would like to emphasize the importance of hand hygiene before going to any patient. Wash your hands, and if alcohol is present, you can use it, and then use personal protective equipment if necessary, such as face masks, gloves, gowns, goggles. And then before going to your patient, you need to gather all your necessary equipment to be used. And when conducting an interview or any procedure to your patient as well, you need to provide privacy and confidentiality. That is an important thing to do. You also need to provide a very calm and quiet environment when conducting an interview or any procedure. Now, the first part of the video is the health history assessment and the PQRST assessment. Hi, good morning.
Hello, good morning.
How are you today?
I'm good.
That's great. My name is Rian, and I'm a nurse in this unit. Before anything else, may you state your name and your birthday?
My name is Jeffrey Mabini, and my birthday is July 20, 1991.
Okay, let me check your wristband. Jeffrey Mabini, Mr. Jeffrey Mabini, and your birthday is July 20, 1991. And your hospital number? 1, 2, 3, 4, 5, 6. Okay, that's good. Well, I'm here today to examine the make a health assessment with you because you have a chest pain when you came here, right?
Yeah.
Okay. Based on your chief complaint of chest pain, what do you think makes it better? Does the pain you're feeling right now change with reposition?
No, nothing makes it better or worse.
Okay. What does provoke the pain?
Shoveling snow brought it on.
So can you describe the pain or discomfort?
It feels like crushing pain.
Crushing pain. Interesting. So, can you point it out? Where's the pain you're feeling, and does it radiate in any other part or areas of your body?
Um, it's mainly in the chest, but also radiates down on the left side of my arm.
Mm-hmm. I'll give you a pain. Can you describe the pain using a pain scale? I'll give a 0 to 10. Can you rate it? 0 as no pain, and 10 as the most excruciating pain.
Well, probably I will gonna put it on 8 out of 10.
Okay, so when does the pain started?
The pain started after I shovel a snow.
Mm-hmm. Well, how long?
Mm,
How long did you
and it lasts for a minute, couple of minutes.
for a couple of minutes?
Yeah.
And how often do you feel the pain?
Just this morning.
Just this morning. Have you had the pain previously?
I have never had pain like this before.
Mm-hmm. So, what do you think it means?
I thought I have a heart attack.
So, we are gonna follow up with a couple of questions and physical assessment for us to give, hopefully, a better understanding of what is going on.
Okay, great, thank you.
Okay. So my first question, or my first follow-up question is, do you have trouble breathing?
Not at all.
Mm-hmm. So, how about when you were lying down? Do you have any trouble breathing?
No.
Do you have any cough?
No.
No. Do you feel any for these past few days? Do you feel any fatigue, like when you were doing household chores? Do you get easily tired?
I feel very tired right now. My wife had to help me get into the car and go into the hospital.
Mm-hmm. Can I just check your things? Oh well, it looks like you're pale, but you don't like you don't look like cyanotic at all. Can I check if Then now can I check if you have an edema to your face? Can I check your hand? Your feet? The other one, please. Okay, thank you. No edema, no signs of any edema. And then, well, do you have any trouble urinating?
No.
No. Okay. Um, Now, do you have any history of cardiac problems before, like hypertension or high cholesterol level?
Yes, I have a high cholesterol for 5 years.
For 5 years.
Yes.
Okay. How about your family cardiac history?
My father had MI
Mm-hmm.
at 51 years of age.
How about your other members of your family? Do they have any cardiac history as well?
My father's side of the family have heart attacks and high cholesterol level.
First, place your warm hand at the apex of your heart, where the apical impulse is located. If palpable, it is located at the left fifth intercostal space, mid-clavicular line. It should be no longer than systole and no wider than 1 centimeter. You should feel gentle with no heaves or lifts. Next, move your hand to the left sternal border and feel for any displaced or widened impulse or any other abnormalities. And then move your hand to the base of the heart and feel any abnormalities. You can find brushing vibration, which is called thrills in this location. During palpation, point the maximal impulse located where the apical impulse is the strongest. At this point, ask the patient to move his head to the left. Can you move your head to the left, please? And then using your other hand, feel the carotid pulse. The pulse should be synchronous. Now we're gonna auscultate the heart sounds. But first we need to locate the 4 sides, which are the aortic, which is located at the second intercostal space right. This mic here. And then next would be the pulmonic, which is located at the left second intercostal space right here. And then the tricuspid will be located at the 4th intercostal space down here. And then lastly, the mitral, which is located at the mid-clavicular line of the 5th intercostal space right here. This will be your mitral. Now, the S2 sound, which is the dub, will best heard here at your aortic and your pulmonic. And then the lub, which is the S1, is best heard here at the tricuspid and the mitral area here. Okay? And then we're going to try to hear the heart sounds using the diaphragm. Here. Let's hear the high pitch sounds. Okay. Your aortic. Your pulmonic. Your tricuspid. And your mitral. Now we're going to try to hear with the bell. Here, this one, which hears a low-pitched sound like murmurs. Aortic. The pulmonic. Your tricuspid, down here. And your mitral. Now, I'm gonna obtain an apical pulse, flow rate, and rhythm at the mitral area for a full 1 minute. Okay, here is the mitral area. Now, I'm gonna use the diaphragm. Okay. Okay. So, for a full 1 minute, I heard a rate of 71, and I don't find any murmurs.